Imagine you're sitting at the doctor's office, already stressed about your health, and then a few weeks later a bill arrives that is bigger than your rent, your car payment, and your grocery budget combined. You stare at it and think, how on earth am I supposed to pay this? That's the reality for millions of Americans drowning in medical debt. But here's the secret most people don't know. There are ways to get part or even all of that debt forgiven. And today, I'm going to walk you through a complete guide so you never feel trapped by medical bills again. Number 1. Why medical debt is different. Medical debt is unlike most other kinds of debt because it usually comes from an emergency. Nobody plans to break a leg, get cancer, or have a baby that ends up in the ICU. That's why medical debt can sneak up on you. Unlike credit card debt, you didn't choose to spend the money. Here's an example. Imagine Sarah, who works a retail job. She doesn't have great insurance. She slips at work, breaks her ankle, and ends up with a $10,000 bill. She never asked for this expense, but the hospital still expects payment. The good news is that medical debt often has more forgiveness programs and protections compared to other debts. And that's what we're going to uncover step by step. Number 2. The new rule about credit reports. Here's something many people don't realize. In recent years, major credit reporting agencies like Experian, Equifax, and TransUnion agreed to remove many forms of medical debt from credit reports. If your medical bill was under $500, it won't show up at all. If it was larger but you paid it, it also gets erased after a year. That means your credit score may recover faster than you think. Think of it this way. If Sarah from earlier struggles for months, but finally pays off that $10,000 bill, her credit report won't drag her down forever. That's a huge relief for people worried about their future loans or even renting an apartment. But here's the catch. Unpaid medical bills can still go to collections. So the key is knowing how to act before it gets that far. Number 3. Negotiating with the hospital or clinic. This is one of the most powerful steps most people never try. Hospitals often inflate their prices, expecting insurance companies to bargain. If you're uninsured or underinsured, you're stuck with the sticker price, which is usually way higher than the real cost. Here's a secret. You can negotiate. Call the billing department and say, I can't afford this. Do you offer financial assistance or a discount for paying in cash? For example, John owed $5,000 after a surgery. He asked the hospital if they had a charity care program. They reviewed his income and reduced his bill to $500. That's a 90% cut just by asking. It feels awkward to negotiate, but hospitals expect it. They would rather get something than nothing. Number 4. Charity care and hospital assistance programs. Every nonprofit hospital in the USA is required by law to offer financial assistance, but they don't always advertise it. If your income is under a certain level, sometimes equal to 2 or 3 times the federal poverty line, your bill could be reduced or erased entirely. For example, a family of 4 making $50,000 a year might still qualify for partial forgiveness. You usually have to fill out a form, share your tax returns or pay stubs, and explain your financial hardship. Here's the loop. Many families never even apply because they don't know these programs exist. That means billions of dollars in potential debt forgiveness are just sitting there, unclaimed. Number 5. Nonprofit organizations that forgive medical debt. Have you ever heard of a group called RIP Medical Debt? They literally buy medical debt for pennies on the dollar and then forgive it. That means your $1,000 debt might be purchased for $10. And instead of sending you a scary collections letter, they send you a letter saying your debt is gone. Since they started, RIP Medical Debt has cleared over $10 billion of medical bills for millions of Americans. And here's the kicker. You don't apply for it. They choose accounts randomly through partnerships with hospitals and debt collectors. So while you can't guarantee they'll buy your debt, it's a reminder that help does exist in surprising places. Number 6. Government forgiveness programs. Depending on your state, there might be local programs designed to wipe out or reduce medical debt. Some states like Connecticut and New York have even passed laws to protect patients from aggressive collections. In certain areas, local governments partner with charities to buy and cancel medical debt for residents. If you've heard about people getting letters saying their debt is gone, this is often how it happens. This is why staying updated on your state's health department website can be a game changer. Number 7. Using insurance appeals. Sometimes your insurance company denies coverage, leaving you with a giant bill. But here's the thing. You can appeal. Insurance companies deny claims all the time, hoping people just give up. But many people who push back end up winning. Example: Lisa had a $20,000 chemotherapy bill denied. She appealed, sent a letter from her doctor, and fought it. 3 months later, the insurance company agreed to cover it. Her out-of-pocket cost went down to $2,000. The lesson: never accept the first denial as final. Number 8. Payment plans that make sense. Even if your debt isn't forgiven, hospitals often allow no-interest payment plans. Instead of owing $5,000 immediately, you might break it into $100 a month. This doesn't erase the debt, but it can save you from collections and keep your credit intact. Just make sure you get the terms in writing. Here's a tip: avoid putting medical bills on a credit card. Once it's credit card debt, you lose all the protections and forgiveness options of medical debt. If you keep it as medical debt, you can still negotiate, seek forgiveness, or apply for charity care. Number 9. Bankruptcy as a last resort. Nobody wants to file bankruptcy, but it's important to know it exists as an option. Medical debt is one of the leading reasons Americans file. In Chapter 7 bankruptcy, medical debt is unsecured, which means it can often be fully discharged. In Chapter 13, you may pay a portion over time and the rest is forgiven. For example, Mike had $100,000 in medical debt after heart surgery. Filing bankruptcy gave him a fresh start. It's a big step, but sometimes it's the only way forward. Number 10. Protecting yourself in the future. The best forgiveness is prevention. That means understanding your health insurance, knowing your deductible, and having an emergency fund when possible. It also means checking every medical bill for errors. Studies show up to 80% of medical bills have mistakes. Imagine paying thousands for a test you never had. Always ask for an itemized bill. Here's a simple example. Jane noticed she was billed twice for the same X-ray. She called, and the hospital removed $800 from her bill. Being proactive now can save you from needing forgiveness later. Number 11. The emotional side of medical debt. Let's be honest. Medical debt isn't just numbers on paper. It causes stress, broken families, and even depression. One study found that people with medical debt are more likely to delay care, which can make their health worse. It becomes a cycle. Debt causes stress, stress causes health problems cause more debt. That's why forgiveness isn't just financial. It's emotional freedom. Imagine the relief of opening your mailbox and seeing a letter that says, "Your medical debt has been forgiven." That's not just about money. That's about hope. Number 12. Employer-based assistance programs. Some employers offer hardship programs or employee assistance programs that cover medical costs. These benefits are not always advertised, so many workers never ask. For example, a large retail chain once paid off part of an employee's hospital stay through a wellness benefit. It never hurts to ask your HR department if help is available. Number 13. Community and religious support. Local churches, mosques, temples, and community groups often set up emergency funds for medical needs. They may not pay the full balance, but they can cover a portion, which reduces what you owe. One family in Texas received $2,000 from their church community to cover a newborn's NICU expenses. That donation helped them avoid debt collectors while they worked out a payment plan for the rest. Number 14. Crowdfunding as a debt tool. Websites like GoFundMe are often used for medical emergencies. While it is not guaranteed, many families raise thousands of dollars from friends, family, and strangers. A young woman with leukemia once raised over $50,000 to cover her treatment bills. Even if it doesn't clear everything, it can ease the pressure and prevent you from falling behind. Number 15. Legal aid and patient advocates. Some lawyers and nonprofit advocates specialize in fighting unfair medical bills. They may help you challenge surprise bills or protect you against aggressive collections. For example, a patient advocate helped one man prove that a surgery was coded incorrectly, which reduced his bill by 70%. Legal aid organizations often provide these services for free or at low cost if your income qualifies. Number 16. Health savings accounts and flexible spending accounts. If you have access to a health savings account or a flexible spending account, These accounts let you pay medical bills with pre-tax dollars. While this does not erase debt, it reduces the financial burden because you are paying with money that is not taxed. For example, using $2,000 from an HSA could save you hundreds of dollars in taxes compared to paying the same bill with after-tax income. This can make debt repayment easier and faster. Number 17. State surprise billing protections. Some states have passed laws against surprise medical bills, especially for emergency care or out-of-network charges. This means you may not have to pay the full bill if you were treated without being able to choose your provider. For example, if you had surgery at an in-network hospital but the anesthesiologist was out-of-network, laws in certain states prevent you from being billed the inflated out-of-network rate. Knowing your rights can save you thousands of dollars. Number 18. Employer insurance appeals. If your job provides health insurance, your employer's HR or benefits team can sometimes step in and pressure the insurance company to approve a claim. This can be more effective than appealing on your own. For instance, a worker's spinal surgery was initially denied, but HR contacted the insurance provider directly and got it approved, eliminating $30,000 of potential debt. Never underestimate the influence your employer may have in these cases. So here's the bottom line. Medical debt can feel like quicksand, pulling you down no matter how hard you fight. But there are real lifelines: negotiating, hospital charity programs, nonprofit groups, government initiatives, and even bankruptcy when nothing else works. If you take away one thing today, it's this: you are not powerless. Medical debt forgiveness is real, and it could change your life. Now I want to hear from you. If you woke up tomorrow and all your medical debt was forgiven, what would you do with the fresh start?